name is Obisike Danedikechi. What I see is that my waist is paining me at that one time when I cough. As I cough, the next thing I see something swallow up like this. And that thing swallow up, I can't go health center. So I go health center, they can't tell me, say, this is the problem. So I will come to hospital. They admit me. As I came here, they admit me. They do everything, even though they did the surgery, everything. Now yesterday when they did the surgery, as they did the surgery, everything is moving, even though I can move around, there's no problem. Even though I can't eat anything at all. I thank God, may God promote our governors and the hospital. This hospital they bring for us. It will say it's not, it will say they didn't bring something like this. I'm sure so many people will die. I always thank God. May God give the governor and the president how to still handle us. That is what I have to say.
I'm from Omakri, Oburu Omakri. I got sickness from myself. As I went to health center, as I went there, they said that it's ulcer. Listen, they started giving me this drugs and what's the rest of things. After some time, I come experience one other sickness too. They said that it's hernia. They refer me to this place. I come here. As I come here now, they are taking care of me. And all of them, they are all taking good care of me and all this is. Even some of my people don't know that I'm here safe. I'm now calling them, telling them that I'm here. They're taking good care of me. And thanking them so much. They go, we pay them back.
Good morning, viewers all around Port Harcourt. How are you all doing? It's another episode of the Rivchpp Testimony Thursday. And I'm here with the HOD Planning Research and Statistics, Dr. Juliet Aleme. How are you doing, Ma?
I'm fine, thank you. Good morning, viewers.
All right, so we'll go straight to the video. In the video we just watched, we saw two aged men and they were talking about experiencing pain around their waist region that developed into a possible enlargement around the scrotal region. And that's had to be the reason why they were referred from the health centers to the secondary level of care, the secondary facility, which can also be a private facility. So, Mark, could you please walk us through all of that?
Okay, so what they described is what we call inguinoscrotal hernia. Hernia, for the layman term. Hernias actually are common and amongst aging men, and is a condition in which there is a defect, there is an abnormality, a little opening in the abdominal wall that now makes it to connect with the scrotal organ, that is the male organ, and then substances like fluid and even sometimes tissue can actually pass through that organ into the scrotum and then makes it to get enlarged. And usually men observe it when they cough because at that point they are exerting pressure on the abdominal organ. So those things that are there in the abdomen, they rush down to that organ and then it gets big. Sometimes it can just recede, that is get smaller and then get bigger with activities like that. So that is gnoscrotal hernia, or the condition.
All right, thank you very much, Ma. So why the urgent need for a referral from the primary level of care to the secondary level of care?
Okay, hernias generally are managed as surgical cases. They are actually for surgeries. So the primary level of care does not take care of, does not perform surgeries. And then also hernias can get complicated in that tissues, abdominal tissues can actually go there, herniate into that, and then find it difficult to get back into the abdomen and then restrict fluid, uh, supply of blood and other vital minerals to the body. It can actually get strangulated in that when it goes in there, it can't come out, causes a lot of pain, necrosis, death, and actually it's life threatening. So that is why they refer to the secondary level of care for urgent attention.
Thank you very much, Ma. Finally, I would love to know, I think our viewers will also want to know, because we saw in the video that they were aged men, maybe in their late 50s or early 60s. So I would want to ask, is this, is there an age bracket to this or is commonly found amongst aged men?
Okay, though hernias can be found in any age group, it's actually commoner as when the age increases, especially amongst men that are 65 years and above. It becomes commoner amongst aging men, although it can be found in any age group. Let me also use this opportunity to just inform our viewers so that because there are risk factors, there are things that can actually predispose a male to having this. One is chronic cough. So once someone has cough that lasted for more than 2 weeks, it's called termed a chronic cough. So once there is cough, try as much as possible to go treat yourself before it results into something that is not expected. And then also there are also heavy lifting, like people that carry a lot of weight, bags of gari beans, they carry it on themselves. They are exerting a lot of pressure on the abdominal tissues. And also musical instruments such as blowing of the saxophone and trumpets, wind instruments generally, because the process of trying to blow into that instrument exerts pressure on the abdominal wall. So these are things that can actually predispose someone to having hernias. It's also common amongst males than females, the invuloscrotal hernia. So yes, it's commoner with advancing age.
Thank you very much, man, for that detailed answer. All right, viewers, you have heard from our doctor, Dr. Juliet Aleme, the HOD, Planning Research and Statistics, River State Contributory Health Protection Program. All right, we will see again same time next week. Bye-bye.